Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of ENT is airway management. This topic we will discuss in 5 different sections. In the first section, we will talk about the overview of tracheostomy. What is tracheostomy? What are the functions of tracheostomy and why we do tracheostomy? What are some conditions that we need to do tracheostomy in patients or indications of tracheostomy? Then in the second section, we will talk about types of tracheostomy, which can be emergency tracheostomy. Then we have elective tracheostomy, which is performed as a routine procedure. And then also we will talk about different types of elective tracheostomy. In the third section, we will talk about the condition known as permanent tracheostomy, which can be the high, mid, and low tracheostomy, depending on the level of trachea at which tracheostomy can be performed. Then we will talk about the technique and steps of operation of tracheostomy. Then we will discuss in the third section also the tracheostomy in children and infants. Then in the fourth section, we will talk about the post-operative care of tracheostomy, very, very important subject, because proper management and care of tracheostomy once the procedure is performed is very, very important. And then we will also talk about the decannulation and what are some complications of decannulation and what's the reasons for the failure of decannulation. Then in the fifth and final section, we will talk about the emergency tracheostomy, jaw thrust and oropharyngeal airway, laryngeal mask airway and cricothyrotomy. And also we will talk about the percutaneous dilational tracheostomy. So all these are some emergency procedures that can be performed. So today our topic is very, very important, in which we will talk in detail about all the steps and indications and complications associated with the airway management. And the most important procedure done for the airway management is the tracheostomy, which can be emergency tracheostomy or elective tracheostomy, and also it's permanent also in patients who have problems like who cannot breathe normally and who cannot maintain the breathing normally. They might need the permanent tracheostomy. So all that will be covered in our today's topic, airway management. Keep watching sqadia.com.